At some point during this lifetime, you or someone you love will face very hard health decisions or an end-of-life journey. And today we're joined by legendary palliative Dr. Sugar, Paul Sugar, who's also been titled the Good Shepherd. He walks people to the pearly gates. He helped my family. He's helped just so many families for decades. I just want you to tell us, how do you do what you do? It's not an easy path. Why did you choose this?
It's, honestly, I would say that I get so much back from making the best of a difficult situation. I feel like I can see it. I feel like I can see what's needed. I feel like I can tune into the individual in front of me and try and bring the truth of what's happening and the best of what's happening to play.
You're the light in the darkness and the calm in the storm, really. I mean, your emotions are running so high when you're dealing with really any health issue, let alone end of life.
People are confused, they're afraid. They're walking down the street one day and they're looking at everybody else. And the next day, they've gotten some bad news and they feel alone. They feel totally alone with that, and they don't feel like they're part of the world anymore in some ways.
So why is it so important for us to advocate, no matter what the scenario really, for ourselves or our loved ones in the medical system, and how do we do that?
Well, the medical system, we know it's got limited resources. We know that it's become increasingly corporate. We know that the things that are needed are not always in place. And that was one of the main reasons that we formed the Paul Sugar Palliative Support Foundation, because the non-medical supports that are needed, the things that people need on a human level, those are the things that are woefully lacking. I mean, in the old days, I guess family doctors provided that, but people don't have family doctors. People see a different doctor every day, and it's just a much needed thing so that things can be peaceful in the hearts and minds of people who are ill and their families.
And so how do you approach these conversations? They're so hard to have, making sure that your affairs are in order, especially if your loved one doesn't even want to talk about the fact that they're dying.
Well, the first thing you have to do is gain some trust. And that means you have to meet people where they are. I've always seen my job as trying to fit into someone else's box, the patient's box, not them fitting into my sense of protocol or, they need to be treated as the unique person they are. And they need to be told that their life matters. They need to be told that their death matters. And they need to be told that they have choices as to how all those things are going to go.
Okay, so what if your loved one, their choices might be different than the hospital is wanting or you're wanting as, the caregiver? How do you navigate that?
The patient. It's, what do you want? It's a simple question. What do you want to see happen? And, it can come to various choices that person is not willing to approach. But at the same time, if you give them enough time and they have enough trust, they'll come to it. They'll decide what it is they want. Sometimes they don't want to do, if the family wants them to not be at home, but they do, then you have to try and reassure the family. When someone gets ill, it's not just the patient. It's the family. It's the whole circumstance that has to be taken care of. And that makes it easier for the patient.
So how do you find that right person, that palliative doctor, to be that guide? You came to me, you just fell out of the sky in my lap, I think, when I needed it the most. But how do you find that right team? And what if you don't like your team?
Well, I think even if you don't like your team, what you have to recognize is that you matter. Your family matters, you matter, the patient matters, and they need to feel like that. And then they can speak up and stand up and say, this is what we want, and how can we make that happen? And it's always important, you know, you don't want to be labeled, as people are in the medical system, as someone who's obstructive or as someone who's difficult. There was a Seinfeld on that before. The difficult patient. You want to be polite.
Well, emotions are running so high. It's so hard to keep them in check.
It is. It's very hard. And I think it's up to the healthcare professionals to understand that. You know, I mean, I remember so many patients who the first words they said to me were curses and who the F are you? And you have to suck that up, because they're in the predicament, you're not. And it's your job to hold them, not their job to make you feel better about what you're doing.
Okay, so you're in this messy journey. What resources can you recommend to families?
Well, you know, your best resource for advocacy, and let's see what advocacy is. Your best resources for someone who's an advocate. Advocacy is standing up for the rights and wishes of yourself or a patient, and or someone else, a family member, a loved one. And that's advocacy. And you need to be seen, you need to be heard, and someone needs to be listening, and someone needs to be honoring those wishes. So it's a dance.
It really is.
And not everybody can do that dance. And, you know.
So what if that person can't, and they're the ones holding that journey for your loved one?
Then you need an advocate. Then you need an advocate, as I was able to help you. And you need to encourage people that they're stronger than they think. And I think, particularly in your case, you know, when things go as they should, it makes the grief afterwards much easier.
Yeah, for grief, Lumara Society, I mean, just incredible, right? There is, and you had a booklet there that you said you wanted to recommend.
This is not for grief so much, but this is, I don't know if we can get a picture of this somewhere.
Navigating the BC. Where would one get one of those? A copy?
You could probably look it up online and figure it out. The person who did this, Connie Jorsvik, is a professional advocate. And she wrote this, and it's very useful for people who really don't know where to turn and how the system works. It's a useful
And
thing.
your website for the Paul Sugar Foundation?
Yeah, that's under Paul Sugar Palliative, the Paul Sugar Palliative Support Foundation, and that's what we do as well. We advocate, we encourage, we support, we help people navigate what is a very complex, difficult system. And we tell them, you know, you have to stand up and you have to, and if you can't, we will help you.
Thank you so much, Paul, for being here. Stay with us. More news is coming up.